Did you know that 17% of adult children care for their parents at some time in their lives? And 1 out of 6 employees is caring for an adult, for their aging parents. Employers spend an additional 8% more on healthcare coverage for their employee family caregivers because of the chronic illnesses that these employees chronically suffered because of the stress associated with family caregiving. The whole country spent an additional $34 billion in healthcare coverage for employee family caregivers. Corporations in America lose $17.1 to $33 billion a year of lost productivity associated with family caregiving. Today, we will embark on a journey of countless employees who are shouldering silently the dual responsibility of their careers and caring for an aging loved one. Imagine this. It's Monday morning. You are getting ready for work and you have a very important meeting today. Your mind is racing with talking points and deadlines. You're trying to get the kids out of the house. You're making lunch. You're looking out over the calendar for after-school activities, and all of a sudden, the phone rings. It's your aging mother. She's 75 years old. She has a little bit of dementia already. She lives alone, and this morning while getting in the shower, she fell. This is not uncommon. This is a reality for millions of employees in America, and I would like to take you through the journey of their challenges every day that they have to face. My name is Emma Soy. I am the nurse owner and CEO of Gentle Shepherd Care. For the past over more than 35 years, I have built my understanding of patient and family needs. I know the option for elder care and the questions that families are asking on a regular basis. In 2019, I started a home care company to help older adults age gracefully with dignity wherever they call home. But what I discovered was this: the people who care for my clients, they are lost. They have no support. See, most of them work full-time. They are caring for their homes, caring for their children, while also caring for an aging mother maybe living with Alzheimer's and dementia. They are stressed. They are stretched. They have nowhere to turn. They're trying to juggle between their work responsibilities and their duties as daughters caring for their mothers. Pass on career opportunities, taking time off, reducing their work hours. The stress of caregiving can have such a toll on them, emotionally, physically, even to the detriment of their own health. See, most corporations have what they call an employee assistance program. We call it the EAP. And I would like to take you through what a family have to go through when they have to access this kind of benefit. See, like Stella this morning, after she get this call from her mother, what is she supposed to do? She's gonna miss work. Why? Because she doesn't have anything set up ahead of time to respond to this kind of crisis. She's missing work. She's canceling all her meetings for the day. Maybe losing a client, or then maybe even her job. Who knows? She has to take the day off to be with her mother, maybe a couple days. And she remembers in the middle of it, she has a benefit at work for employee assistance program. And she calls the hotline. What she gets in return is a long, confusing list of providers that she has to come through herself. And when she finally comes through it and finds somebody and she hires someone just to help her this one time, well, what happened next time when something else happened? Another crisis. Where does she get all her answer questions that she has about her mother, her progressive disease? Where does she get the resources that she needs to help her with her dual role as a worker and a family caregiver? I tell you, there gotta be a better way. And there is a better way. The better way is this, is for people to have a proactive plan that help them to set up things ahead of time so they don't have to always reacting to crisis. Instead, they have a good care aging plan so they can respond to crisis. See, most people have funeral plans, but yet they don't have an aging care plan. See, this is what I say all the time. You will age before you die. So if you are going to age before you die, you need to have an aging plan instead of a funeral plan. I say this, unless you have a sudden death event, you will age before you die. So have a plan that says where you're going to age and how you're going to age. For your families to care for you well, give them a plan where you're going to age, how you're going to pay age, how much is that going to cost? And when you do that, you can thrive as you age gracefully and also on your own terms. Corporations can help their employees by providing the support that they need. See, when employees do not have the support that they need within or outside the workplace, it just exacerbates the problem. It's just get worse and it's not getting any better. Employers can offer assistance by helping people to plan ahead so they don't have to wait until something happens to offer help. Proactive plan that help people to set up things ahead of time so they can help their employees to maneuver between how to care for their aging parents. Foster a forum where employees can receive help, answer questions about elder care. Having a support system of other employees that are going through the same kind of challenges. Employers can also offer what they call sensitivity training to teach managers how to identify people that are going through this kind of challenge and to gear them to the right solution so they can relieve the stress of caregiving. See, when employees get the help that they need, they will show up for work and they will stay at work. And employers can decrease the gap, the $33 billion gap. They can increase productivity. They can increase employee loyalty. Employees can take on more responsibilities. They can be present without worrying if their mother is going to be setting the house on fire while they're at work. And they can do their duties that the employers are expected them to do. See, an elder care employee assistance program at work is a growing need because 61% of the general population is a family caregiver. By 2030, 1 out of 5 Americans will be 65 or over. And the baby boomer generation is the fastest group in America. Yet, in 2022, corporations in America spent $4.5 billion in employee assistance programs. And most of them focus on mental health and substance abuse. And corporations are complaining employees are not even using those benefits because of the stigma that comes with these kinds of issues. So an employee elder care at work program with a proactive focus is the right solution for both employees and employers. There's a corporation who understood this kind of issue. They wanted to provide the support for their employees. And they knew that this issue is so heavy. They understood that their employees are shouldering the responsibility of their careers and also caring for aging care loved ones at home, and how that could affect their productivity and even their health and job satisfaction. So they put together this complete, strong, comprehensive elder care program in their corporations. And that program had some really good key component to it. They had number one, life care planning that helped their employees to create a care plan specific to the aging loved ones. Also they help them to set up system and services ahead of time so they can respond appropriately to elder care crisis. Number two, they have access to experts that they can talk to help them to navigate to the complexity of elder care. They also have what they call emergency elder care backup care service set up ahead of time to help employees to respond to urgent work commitments, or if they have to travel for emergency or travel for work and they have to still care for their aging loved ones. Part of the program also was a repository of resources on elder care topics that employees had access to. Also, a community, a support group for employees so they can come together and talk about strategies, how to balance work life, and also caring for their aging loved ones. And that program was so popular and had such great positive outcome. One of their employees, her name is Sarah. She was known to be a really hard worker, very committed to her work, until she had to face that her father was diagnosed with Alzheimer's and he was declining really fast. She found herself being overwhelmed, taking on more responsibilities, doctor's appointments, and coordinating his care, even his daily needs. And then she found it was hard for her to manage her work and caring for him. She remembered that benefit was available. She called them. After her first meeting with the consultant, she was able to go back to her manager and negotiated flexible time. When she did that, that gave her more time, not only to continue to excel at work, but also to have time to spend with her dad. The coordinator helped her to put together a plan specifically for her father. The coordinator helped her set up services, home care services, navigate the healthcare system, set up doctor's appointment. And she felt so empowered now that she had the education, the know-how, how to navigate this. She was also part of a community that met regularly talking about strategies. And Sarah became one of the advocates for this program in her workplace, talking about other people about the program, and also became one of the people who support other employees in the corporation that was going through the same issues. And so this particular company recognized what it means to give the support that employees who are facing this kind of issue and to cut down the costs of the lost productivity caused by employee family caregiving. So today, I was able to highlight with you the issue, the problems how to recognize, and also how to provide support to employees who are facing this kind of issue, and the growing need in the workforce and the increasing number of employees who are shouldering their careers in elder care. Thank you.